My name is Bastiaan de Galan. I'm an internal diabetologist based in Nijmegen in the Netherlands. I'm doing research on hypoglycemia in the past 20-25 years. I am the coordinator of a big European project called HyperResolve, which is focused on increasing understanding of hypoglycemia in people with diabetes. Historically, we're mostly focused on people with type 1 diabetes, where hypoglycemia is quite prevalent, particularly in people with long duration of diabetes, because they've lost beta cell function and using insulin. But we now see the same kind of trend in people with type 2 diabetes, and I think that problem has been neglected for a long time and still is being neglected, particularly in in first-line treatment, so with GPs. My experience, obviously I see people more at the end of their diabetes career, if you want to put it that way, where they use a multiple dose of insulin. I think I see basically the same thing in people with type 2 diabetes as in those with type 1 diabetes. So they have multiple episodes of hypoglycemia in weeks or months, and occasionally have a severe episode. And quite a proportion of people have problems with recognizing hypoglycemia, which we call impaired awareness of hypoglycemia. We've done a study a couple of years back where we asked patients about their level of awareness, and we found that 10% of people with type 2 diabetes on insulin, whether they were on basal insulin or multiple dose of insulin, actually could be classified as having impaired awareness of hypoglycemia. And up to a third of patients recalled having a severe event in the past year. So that's quite high numbers, I think. And since the problem of type 2 diabetes is much larger than type 1 diabetes, I think in absolute terms this is a bigger problem. I think hypoglycemia is a big problem in patients with type 2 diabetes, particularly when they start using insulin. And obviously in the beginning, when people get diagnosed, you can treat with diets, with tablets that don't cause hypoglycemia. But people tend to forget that type 2 diabetes is a progressive disease, progressive beta cell failure, so you have to increase the doses, increase the number of tablets, and eventually have to progress to insulin treatment. And people forget that then you actually start your educational process again and tell people about hypoglycemia. This is something that does not occur, at least not in the practice of many GPs. So people are not told about hypoglycemia, yet they will experience them. And then they probably don't report it to their GPs. GPs don't ask about it, so it's a problem that sort of is neglected. But if you really look into it and you ask people about it, you will see that this is actually quite a big problem. I think what has to be done is that we have to increase awareness about this problem with healthcare professionals, particularly in the first line, but actually also with my colleagues in clinics. Tell people about the fact that a large portion of people have problems with hypoglycemia. That's a prevalent problem. That you have to educate patients about this. It's not rocket science. I mean, you just call patients to the clinic, tell them about hypoglycemia, what the symptoms are, what they have to do about it, how they have to titrate insulin, what are carbs, how much sugar you have to take to treat it, how you have to respond to doing physical exercise, for example, or sports. And with that, I don't only mean running or playing soccer, but also working in the garden, for example, or playing golf, taking a stroll, shopping for women, for example, not only women, maybe men as well, but these kind of things that actually are risk factors for hypoglycemia. It's very, very easy to respond to that and manage your diabetes better, so to mitigate the problem. If you want to mitigate the problem of hypoglycemia, I'd start with education, and a good educator, I think, is gold in that respect. But certainly, having a range of different insulins, technology can certainly help. It has helped people with type 1 diabetes, so it will help people with type 2 diabetes as well. And that's something that is not that is not something that has been done very often, and there's a huge debate about it also because it comes at a price. But I think there's certainly subpopulations of people who can actually benefit from having newer insulins and having the possibility to use technological instruments to help them manage their diabetes better. Yes, I certainly do. if you don't discuss hypoglycemia, and that's something that has to be done, but if you don't discuss it, and people will experience hypoglycemia, and it's very often a very awful feeling, people will self-titrate their treatment so to avoid these kind of events. So if you don't discuss that, then the level of glucose control will be poor and will probably remain poor. So it's also important to discuss it in the clinic with healthcare professionals so they can actually tell people what to do with it and still maintain a reasonably or a good glucose control. So that's certainly something that has to happen. I think something that's particularly relevant for the Netherlands is there's a big incentive to have as many as possible the patients with type 2 diabetes remain with the general practitioner. And that obviously has to do with resources and with financial issues, because it's cheaper to manage people in the first line than in the second line. But that shouldn't distract from the fact that some people actually should benefit from being referred to an internist, for example, who is an expert on glucose control and hypoglycemia. Nevertheless, I mean, a lot of education can actually be done in the first line with GPs and educators. And I think if we start to begin to do that, then that will make a huge difference for people with type 2 diabetes.